I am the nurse Dr. Asia, and today we will be learning how to do a manual blood pressure. So what all do you need? You need a stethoscope and you need a blood pressure cuff. All right, so you want to perform hand hygiene and we want to verify the patient. Why are we verifying the patient just to check the blood pressure? Well, we are verifying the patient to make sure that when it's time for us to document, that we're documenting the vitals on the correct patient. So if the patient is sitting in a chair, we want to make sure that they have their feet flat and their legs are not crossed. If the patient is laying in bed, you want to make sure that your patient legs are not crossed. So when it comes to choosing which arm should you use, a couple things you want to pay attention to. So if a patient has an AV fistula in the arm, we don't want to use that. If a patient has had a mastectomy on that side, we don't want to use that. And if your patient, let's say, like has a PICC line or even an IV fluids running on that side, we wouldn't want to use that arm. We would use the other arm. So you also can, if your patient doesn't have anything going on, you could just ask the patient which preference do they prefer. All right, so this patient, we're going to choose this arm right here. So we want to make sure that when we get our blood pressure cuff that we are getting the correct size, because that's important. If you don't have the correct size, your blood pressure can either be super high or super low. So you want to make sure that the cuff fits on the patient's arm. So they have small cuffs, they have regular size cuffs, and they have the cuffs for the big arms. So you want to make sure that you are getting the correct size. So you want to explain to your patient what you're going to do, and that this shouldn't hurt. They may feel some pressure as you're pumping up the blood pressure cuff, but this should only take a minute or so, and you want to have them to relax during this time. So it's best to take a blood pressure when the patient is relaxed. So let's say the patient is all worked up, the patient just got finished with PT and all that kind of things like that. You can expect the blood pressure to be elevated. So we kind of just want to make sure that the patient is relaxed as possible. So we're going to take our blood pressure cuff, and as you can see right here, it has our artery index. So we're going to go to our brachial. So we're going to go right over here. So we're going to place this on the patient's arm, and just have the patient help you. This patient can't help me, but have the patient lift up their arm, and we want to go just a couple inches up, okay? So in nursing school, we require you to do the estimated systolic blood pressure. So have you ever been in a doctor's office and you wonder how the nurse knows how far to pump up your blood pressure cuff? Or do they just pump it up to 200? And you're just like, why are you pumping the why are you pumping the cuff up to 200? My blood pressure is nowhere near that. Well, to prevent that, we want to get the estimated systolic. So the estimated systolic is just a way for us to what? Estimate what your systolic blood pressure is. So your systolic is your top number. So I'm going to show you two ways how you can get that. So the first way is by using your brachial artery. So what you can do is you can feel for your brachial over here. So what are we going to do is we're going to take our get it on this side. So we're going to feel for the brachial artery. So you want to make sure that you're able to palpate it first, right? So we should feel that pulse just going boom, boom, boom. All right, so what we're going to do is we're going to close our valve on here because you need to close your valve. Why? Because you won't be able to pump up anything if your valve is open. So I have my little spangometer. I like to put it down here so I'm able to see it better. So it can be detached so you can put it wherever you need to see. So I've already palpated my brachial artery. So I've already closed my valve. So now I'm going to pump it up. So I should still be able to feel my brachial. Once you stop feeling brachial, we want to note that number. So that brachial I stopped feeling a brachial at 130. So 130 is my estimated systolic blood pressure, but you don't stop there. So we're going to add 20 to 30 mmHgs when it's time for us to pump up our cuff. So that means that if we got 130, we're going to add, we're going to pump up our cuff to either 150 or 160. And that way we should be able to see the estimated systolic between that 130 and that 160, which should be somewhere in between there. So let's say you can't feel the brachial artery, because sometimes it's really hard to feel. Well, I felt mine. I went straight to mine, but I got a little tattoo. Okay, stay on topic. Stay on topic. But let's say you can't feel that. What you can do is you can easily go to your radio, which is right there. And a lot of students love that one because they know how to get to the radio easily. And you would do the same thing. So we would close up our valve because we loosened it up, right, when we deflated it. So we would close up our valve and we will make sure that we're able to palpate, and then we will pump up till we don't feel the radio, I'm sorry, anymore. So again, I start feeling it at 130, so I'll let it go. And what I will do is I will add 20 to 30 to that. So I will still pump up my cuff to 150 to 160. So I'm going to take it to the latter end and I'm going to go up to 160. Now, this is the part where you need your stethoscope. So you want to make sure that you always do a little test run on your stethoscope. Make sure, do a little tap tap. Make sure that you have it in your ear correct. And if you don't hear the tap tap, you may not have it in your ear correct. And also you can like twist this little area to make sure that your stethoscope is even on. So you see right here, just turn it and you can now hear. All right, so what you're gonna do is you're gonna give that patient about 5 minutes before you check their blood pressure, because you just put all that pressure on the artery by pumping it up. We're gonna give it a second to relax. So then you wanna make sure that you're using the diaphragm, which is the big part of the stethoscope. We do not need to be listening with the bell part. We listen with here. So we're gonna place this over our brachial artery right here. So you see how I have it placed? I like to hold mine just like that, and I like to put some pressure on it just so I make it that it's close to the skin, so I'll be able to hear. So this part is, if you got a good stethoscope, then you'll be able to hear. Let's say, or that patient has like a faint pulse, a faint blood pressure, you may have to listen a little closer. So your environmental factors, you want to tell your patient, can you be quiet for a little bit? Tell your family members be quiet a little bit. Turn down the TV. You may need to shut the door or different things like that to make it easier for you to hear. All right, so we said that our estimated was 130, so we're gonna pump our cuff up to 160. All right, so we're gonna close our valve and we're gonna pump until we get to 160. All right, once you get to 160, you're gonna start slowly opening up your valve. You don't want to open up your valve too fast because then you're going to miss the number. So you want to open up your little valve nice and slow. All right, and then you're going to listen for that first beat you hear. That first beat you hear, that's going to be your systolic. And that last beat you hear, that's going to be your diastolic. But in between, you're going to hear a bunch of beats in between, but we're only going to focus on the first one and the last one. Okay. So I got the first one. And I just heard the last one. Once you hear the last one, you're able to open your valve up all the way because you're done. So this patient's blood pressure was 130 over 82. So I first heard the first beat at 130 and I heard the last beat at 82. So this patient's blood pressure is 130 over 82. All right, so you may have to, practice this a couple times. You want to practice on your family and friends, so when it's time for checkoff that you'll be confident in it, you guys. But I tell you this is a fundamental skill that you will use the rest of your nursing journey. So you want to make sure that you are competent in how to take a blood pressure reading. So let's say that we got a super high reading. What we want to do is we want to check the other arm if we can, or you want to give the patient some time to relax and then check the blood pressure reading again. I hope you guys enjoyed this video, and I hope that you learn how to check a manual blood pressure. Thanks for watching.